Hi, I'm Professor Julie Black-Peart, and I'm coming to you from SUNY Downstate Medical Center, and this is Health Center. Today, we're specializing on the College of Health-related professions here at SUNY Downstate. Year 2016, we are celebrating 50 years of providing class education to our community. Not only are we celebrating the 50th anniversary of the College of Health Professions, but also the College of Nursing, the College of Graduate Studies is also celebrating the 50th anniversary. But I'd like to focus on CHIRP. And today I have a very special guest with me, Dr. Sabari from the Occupational Therapy Department. So I'd like to say welcome to you, Dr. Sabari.
Nice to be here.
Good.
Thank you. Thanks.
So we're speaking to an audience of people who might not exactly know what occupational therapy is all about. Why don't we just start out by you maybe explaining a little bit about what that is?
Sure. I think the one reason that people have difficulty understanding what occupational therapists or OTs do is the term occupation, which at the time the field was founded, just after World War I, occupation was used very differently in the lexicon than it is today. And I just want to share an old quote going way back to Thomas Jefferson and a few hundred years ago. But to paraphrase, he said, one of his famous quotes was, "It isn't wealth or splendor, but tranquility and occupation which give meaning to our lives." And I think if you think about that in the term occupation in that context, it becomes clear that occupation is all of the things that people do during the course of their day or the course of their routines within a week or a month that define them. And occupational therapy is about helping people who have some type of a disability that interferes with their capacity to perform all the things that they would like to do within their own life. And we figure out ways. Number one, we figure out what are some skills that the person has the potential to develop that would help them to perform the occupations that they're interested in. And then we go as far as we can, of course, in that realm. But we also consider how can we restructure the way that the tasks are done or the environment in which the tasks are done so that the person can compensate for some limitations and continue to engage in meaningful occupation.
Okay, so some of these things are what we might have heard called daily living, activities of daily living, right? Well, so what kinds of things are we talking about? We're talking about, say for instance, if somebody is injured and they hurt their hand, learning how to eat again, or if they have a broken leg, how to...
Well, it's really
exactly
more than
what
that.
Is it? Yeah.
A person with a broken leg is not going to need an occupational therapist because the leg is going to heal. There'll be a few weeks in the cast, and most folks can figure out how to do all the things they need to do while they're in a cast for a broken leg. Occupational therapists are called in for people with more severe types of limitations.
Right, so give the audience some examples.
Children with developmental disabilities, children on the autism spectrum, adults who have severe peripheral nerve injuries or brain injuries or spinal cord injuries or strokes. These are conditions that don't heal in a specified period of time, and many individuals never return to exactly the same level of capacity that they enjoyed before.
So they have some sort of limitation in their mobility, their ability to do things. They may have some weakness or some paralysis perhaps maybe.
So motor,
Parkinsonism, things like that.
Parkinson's, cognitive impairments, sometimes cognitive or perceptual, the ability to understand the relationships between visual objects in your environment, are invisible to others, but are severely debilitating using a computer for an individual with certain types of cognitive impairments or visual spatial impairments, will be very difficult until the individual learns new strategies for harnessing what abilities they do have.
See, now that's important, something you said, harnessing new strategies to have the ability. What kind of tools are occupational therapists using with their patients in order to help them? Just give an example of a few that might be common.
It really depends if the problem is a motor problem, or if it's a sensory processing problem, or if it's a cognitive problem, or it could be a behavioral problem associated with self-regulation, certainly for children in school who are either on the autism spectrum or who have problems like ADHD. The defining problem for them are behavioral difficulties and difficulties sitting still and handling, say, all the sensory information that's swimming into them.
Let's take that one for an example, because most people are familiar with attention deficit disorder. Okay, so just give an example. Say, for instance, we have a child who's having some difficulty in school. What types of tools or things might an occupational therapist do to help somebody in that sort of situation?
Okay, so the child would work with an occupational therapist, first be assessed by the occupational therapist to determine the very specific nature of what the sensory processing problem might be. It might be that the child is tactilely defensive and or super sensitive to touch types of information. And it's just really difficult to stay in one place because the stimulation of their clothing and the seat and the stimulation of the
hyperactivity portion
lights in the room are all become as if a person with healthy sensory processing abilities was sitting in Times Square all day and expected to attend to a teacher talking.
Okay. So these are some very important skills that an occupational therapist obviously would have to know, right? It's not like going to medical school to go to occupational therapy school. What are some of the requirements for SUNY Downstate has an excellent program here. I understand you've been the director here for 15 years now, the chair of the department. So I imagine you've seen a lot of changes in the industry and in your program. So why don't you let the public know if they're interested, what are the requirements to get in, and what's it all about here?
It actually is very competitive to come into our program. Occupational therapy is a hot career. It's one of the fastest growing health careers. The job market is excellent and growing in geriatric care, in rehabilitation care, in services for children with disabilities. So our students have to have a balance in a science background combined with several psychology prerequisite courses. And when they're here on campus, they start out with the human gross anatomy course, full cadaver dissection. They need to really understand the musculoskeletal system because we are experts in analyzing movement as it relates to functional performance. That's followed by kinesiology, which is the study of movement and the biomechanics of movement. Various labs associated with movement analysis. In addition, our students are getting coursework related to cognitive functioning, related to occupation in daily life. And occupation is more than ADL. Many people know the term activities of daily living, which are the basic self-care tasks. Feeding, dressing, the things we all take for granted, getting into your bathtub or your shower, standing to go to urinate. That has been a goal with many of my stroke survivor patients. And it really makes a difference to be able to stand up and have the sufficient balance to perform that activity in the way that an individual has been accustomed to doing it. But beyond that, occupations also include the myriad of occupations involving using a computer and social engagement, using your smartphone. An occupation for a child is clearly being in school, making friends, engaging in activities, social activities after school.
So it's not just manipulative in terms of what you teach them in terms of hand and eye coordination, but also, I guess, sitting down with them and discussing with them about behaviors and things of that nature as well, right?
Do you mean with our students or with our patients?
With the patients.
Most of our intervention is very activity oriented.
Okay.
So we carefully construct a plan with a goal. The ultimate goal will be related to an occupational area.
Okay.
So if it's a child who can't participate in athletic or other social activities after school because of a physical disability, that will be our end goal. But to get to that goal, there will be smaller sub-goals related to improving balance, improving motor skills, improving social skills, self-regulation. And we will carefully and artfully and creatively, I always hope, design fun things for that child to engage in during the occupational therapy sessions for the purpose of building those skills.
And that's important to keep them engaged. Now, I just want to take a step back because you talked a little bit about the gross anatomy. And that's an interdisciplinary program here at the College of Health-Related Professions.
Right.
That particular course is taken along with the students from physical therapy and physician assistant and diagnostic medical imaging. I don't think they don't take that course, but it's a good thing that we get a chance along the way to work with other disciplines here in CHIRP during your training. How long is the program?
Our program is a master's degree program, so all of our students have an undergraduate bachelor's degree with a designated major. Many of our students have been in honor curricula, so they've done theses for their bachelor's degree. So the master's degree at our program is 2.5 years.
Okay. So they come in here sometimes, so they have to have a baccalaureate degree before they can apply to the program?
Well, they can be finishing their final year of college.
Okay, all right.
Or have finished.
As we'd like to see, hopefully people get a chance and they look at this taping and they'll get an idea about occupational therapy and become interested, not just in the field, but to understand what a wonderful program it is right here at SUNY Downstate. And being that the program has been here for so long, you're offering a wonderful career at a master's degree level from star faculty that have been, I know everybody on your faculty has either been here for quite some time, most of them, and have really gone the long haul to really teach the students well.
We have an excellent reputation in the profession.
Indeed.
All students who apply to OT programs have to do volunteer work so that they understand what occupational therapy is. And our best source of referral is the supervisors at the various clinical sites who very often tell our students, our future students, you know, you really should consider Downstate. We're very impressed with the quality of the knowledge and competence of their graduates.
So they do the volunteer work before they apply? Okay, all right. And when do they have to apply to the program? What the timeline
the details
is?
Of the admissions? The details of the admissions are clearly spelled out on the website.
Okay.
But each year applications are due in November.
Okay.
And decisions are typically made by March, and the students begin in June.
Right. So we'll encourage everybody to take a look at the website ahead of time and look at the occupational therapy curriculum and the goals and what the requirements are for applying to the program so that they can be prepared and have the applications in on time. Are you rolling? Once you get started with your applications, you start taking acceptances right away, or?
We have a very large and highly qualified applicant pool, so we do gather the applications in order to make the best decisions about the very limited number of students that will be accepted into the program.
And I know all the programs here, they have information sessions. Occupational therapy also has that.
I think our information sessions are very effective because at every information session we have a group of student volunteers.
Excellent.
So anyone who comes to an information session can look forward to two components of the session. We have always two faculty members and one member of the admissions staff available for individual meetings.
Right.
So every participant gets to sit down and talk personally with a faculty or staff member. But at the same time, they are engaged in small group discussions led by our own students.
Okay, so tell our audience some things about your program that makes it outstanding. I know
Okay.
that some of your faculty members have wonderful accomplishments, the ones that are here now and that have been here.
Sure.
Talk a little bit
Yeah.
about that.
Well, I hope it sheds a little more light on occupational therapy, that we always maintain a faculty with a representative in each of the following areas of OT.
Okay.
So we always strive to have someone who specializes in treating children in the school system. Many of
Okay.
our grads do go on to work with children in either preschool or school-based programs. Right now we have 3 faculty members with school-based experience.
Okay.
We're also looking for faculty, and we have faculty providing early intervention services, and
Okay.
that is a specialty of our program, and we offer our students advanced education toward being approved providers by New York State's Bureau of Early Intervention.
Oh, okay, so this would be over and above getting the master's degree.
Correct.
This is a special certification that they would be able to have as well?
Correct.
Okay.
It's not called a certification, but yes.
Okay.
We do, so that's early intervention, and we've been funded significantly by the federal, the United States Department of Ed for various programs related to early intervention service provision. We also make sure that we always have a faculty member who specializes in hand therapy.
Okay.
Hand therapy is the most medical of all the orientations in occupational therapy. It's a specialty that developed, in my lifetime, certainly, I guess, about in the 70s and 80s, a group of occupational therapists who were seeing patients after they had very complex hand surgery procedures, designed the credential certified hand therapist. So one of our faculty members, Joan Murray, is a certified hand therapist, and she teaches a specific course related to hand therapy and also to orthotics, because occupational therapists working in hand therapy and other practice areas, we make a lot of things. We're creative with our own hands.
Yes.
We make gadgets, or we'll make adaptations to gadgets, specifically individualized to the client that we're working with.
Say, for instance, someone's having difficulty manipulate like spoons and forks, things to eat, and how about for typing and using the computer and those types of things? It's just explain, because you mentioned a word I don't know if the audience would completely. Orthotics,
means,
yes.
So I think people know the term from orthodontics. Orthotics is something added to the body.
Right.
So we use plastics. So say, for example, an individual who, because of a median nerve injury, a particular type of peripheral nerve injury, doesn't have the ability to move the thumb to oppose to the other fingers. A very commonly crafted splint is an opponent's splint, and that will keep, while the individual is recovering from the peripheral nerve injury, the person will wear this splint so that they can continue to use their hand and continue using all the other muscles in the hand so they don't atrophy during the period of time that the muscles of the thumb are regenerating after the peripheral nerve injury.
Okay, and so just for our audience, when we talk about atrophy, we talk about kind of a wasting away a little bit of that muscle because it's not being used well, and so that's really important to help keep everything nice and strong in the hand and the muscles and that sort of a thing. Okay.
Yeah.
All right. So what other things do you have on the horizon?
Well, I didn't finish all of our...
please do.
So we also always have somebody who's a specialist in neurorehabilitation and general rehabilitation practice. Right now we have Richard Sable, who specializes in adapting Eastern exercise techniques such as yoga and Tai Chi,
Oh,
which are often a
wonderful.
part of people's general repertoire, but using these techniques in a therapeutic way for people with specific disabilities.
Right. And I assume that would be very good for strength, for balance, just for mind and body
Absolutely.
coordination, and just kind of getting back in tune with oneself during a time when they're healing. So that sounds very extremely important to the healing process. And what else do you have?
So Nancy Klein is our specialist in neuro rehab, stroke rehabilitation. Parkinson's, there's been a major shift really in how the medical community views rehabilitation for people with Parkinson's disease. It used to be that a person with Parkinson's disease never saw a rehab professional until they were severely disabled. And now the concept is that in the earlier phases of this disease, to help the individual continue an active lifestyle, and in so doing, keep healthy for a much longer period of time.
Right. That the early intervention is very, very important in all these types of careers. So we have
So I didn't
students.
finish geriatrics.
Oh my God!
is
Oh, there's a
another-
lot.
Yeah.
Well, we'll go right ahead.
And mental health. Suzanne White is our specialist in mental health. OTs also work with individuals with substance abuse problems in day treatment programs. OTs work also in acute mental health units.
Okay.
Helping people to get with schizophrenia or bipolar disorders. These are people with severe psychiatric disorders. Return to the cognitive tasks of being independent in their own home, running their budget in the house, making sure the house is cared for, maybe having pets, planning activities with family, and maintaining social interactions. These are all occupations of interest for people who have long-term psychiatric disabilities.
And I have to say I'm quite intrigued, because even as a physician assistant myself, oftentimes we will refer people to occupational therapy or physical therapy, whatever it happens to be. But even so, sometimes other practitioners are not aware of all the subtle intricacies and things that go about. See, I'm sitting here, I'm talking to you, and I'm learning a little bit too. I mean, I had a basic idea of what I always knew occupational therapy to be, but I had no idea that it was really that quite in depth. So it's really good for not only other practitioners who might happen to be watching this program, but for our general public to understand how important this field is. It really is. And that all of these different areas work closely together. Somebody who's going to see their primary care provider will be referred maybe out to OT or PT or one of these other areas of medicine, because all these things work hand in hand together, right? And we can't nothing works alone in a vacuum. So about the history a little bit of occupational therapy, you spoke about it a little bit in the beginning, or have you? Where are we going from here now, here at SUNY Downstate? I started to ask you before about what's on the horizon.
Right. Well, we're planning to offer a post-professional clinical doctorate in occupational therapy. It would be the OTD, and we've just completed our survey phase. We've interviewed graduates and also conducted a survey where we had 200 of our alumni did respond to our survey about what factors in an OTD program would be appealing to them. We also asked them very specific questions about concentration areas, and we're sifting through that data, and we will be rolling out a plan for a advanced degree, probably with our first specialization in early childhood interventions, but hoping if we are successful with that to then add to that, we've got a lot of interest from our grads for more coursework related to neurorehabilitation.
That's absolutely excellent. So when out in the clinical phase, the students start, how does the program work? They start with the didactic phase, and then they spend time going out into the field doing some sort of clinical work? How does it work?
Right. We're very proud that we integrate the clinical work right from the beginning.
Okay.
We have certain assignments in early classes where students go for a day to do certain assessments on individuals, either in the community or in occupational therapy clinical sites. We also have level 1 field work, which is integrated with what we call our theory and practice classes, one in mental health, one in adult and geriatric rehab, and one in pediatrics. And during these experiences, students are either going 1 day a week for some of them, or for adult and geriatric rehab, they go 3 days a week for 4 weeks in a row, and that's surrounded by coursework related to the things that they're seeing and the assignments that they have.
So they're really jumping right in early on. It's very hands-on.
It is very hands-on, and our classes are very interactive as well. But then in addition, at the very end of the experience, students do a full 6 months of full-time work in a minimum of 2 different settings.
Right. So quickly, maybe just talk about where do the students do their clinical rotations?
Okay.
Here in Brooklyn, or do they go other places?
Well, certainly in the New York metro area, we're not confined to Brooklyn for our sites. And we do have some national and international placements. We're working hard to expand in that area.
Right. So that's very good. So in a nutshell, for anybody who's interested, SUNY Downstate offers a comprehensive master's degree program as we speak now in occupational therapy. Am I correct? Right? And we are looking to have interested people look on the website. We're at www.downstate.edu. On the left side, you will look up the tab for CHIRP, the College of Health Related Professions, and look for OT, and see the curriculum and all the course offerings for the occupational therapy program. Any last words?
I'm very proud of the video that actually one of our grads compiled for us with interview vignettes from our own students. And many of our applicants mentioned that they've been really excited by what the message of the video is.
So they see that, and that generates interest. Well, I'd like to say thank you very much, Dr. Joy Sabari, for joining us for this 50th anniversary celebration of CHIRP and talking about the occupational therapy program here at SUNY Downstate. So for Health Center, this is Julie Black-Peart for Health Center at SUNY Downstate. Thank you very much.